Today. Happy Wednesday. I usually like to wait a minute or two to allow people to join, but I think we have a busy hour, so I'm going to go ahead and get started. My name is Carrington Lott. I'm the Deputy Director at Systems for Action. And Systems for Action, if you're not familiar, is a national research program office of the Robert Wood Johnson Foundation. Our particular program office is housed at the Colorado School of Public Health in the Health Systems Management and Policy Department. One of the main activities that we do as a national program office is develop and release funding opportunities with the support of Robert Wood Johnson Foundation that solicits ideas of aligning systems. And when we say systems, we're really particularly interested in the medical, public health, and social service systems. So today, you're going to be hearing from one of our teams that applied to the 2022 funding opportunity that we had, and their project started up in 2023. They applied to a 12-month developmental pilot study award, and they are almost wrapped up. And so today you're going to be joining to hear from their team on all of the activities that they've done in the past year. It is a lot. They've done a lot of wonderful things. And they're going to be presenting on their project, which is titled Systems Alignment to Optimize Health Among Youth Experiencing Homelessness in Hennepin County, Minnesota. I think before we get started, you'll probably also notice that we have a lot of panelists here. I think I'm going to go ahead and take a second to brag on this team because I think they do a fantastic job of researching with youth in a way that is nothing about us without us. And so they have invited a lot of the community members, which is the youth, to come and participate in this research in progress webinar series today. So you're going to have the chance to hear from them today as well, which is really exciting. Jana, can I get you to go to the next slide, and I'll cover a couple of housekeeping items before.
Whoop.
That's great. Well, I guess we don't have a schedule. That's all right.
Sorry.
We're here in our welcome right now. We'll have the team present for about 45 minutes, and then we'll save some time at the end for questions and answers. If any questions come up at any point during the webinar today, you can locate the Q&A box at the bottom of your Zoom screen, jot your question in there, and we'll make sure that we save time at the end of today's session to address those questions. And then lastly, this is a recorded session. So after today's presentation, we will send out an email that has the recording as well as the slides. So with that, I'm going to hand it over to you, Jana, to kick us off.
Hi there. Yeah. So I'm Jana Gortz O'Brien. I use she, her pronouns. I direct what's called the Youth Health and Housing Lab at the University of Minnesota. And I'm here today with our whole team to share a little bit about our project to align systems to optimize health among youth experiencing homelessness. Here's a little bit of an overview of what we're planning to do. We'll start with an overview of our systems alignment project. We'll then talk through 4 different systems alignment strategies, all of which emerge directly from young people, including some of the youth leaders that you'll hear on this call today. We'll then talk about our data systems alignment planning, which is a big part of this process, thinking about an equitable data ecosystem to support a lot of the systems alignment work we're doing. We'll wrap up with some next steps, which will be really quick, kind of where we're going. And then finally, we'll finish off with some Q&A. I'm going to have each of the people on the call who are co-presenting with me introduce themselves. I'll share a little bit about the lab first. So our lab leads community engaged youth participatory action research at and multi-sector work at the intersection of housing, healthcare, and public health to optimize health and bolster resilience among youth experiencing homelessness. I'm going to leave this up. Our website has a little bit more about who we are, but I'll ask for each of the co-presenters to share just their name and their pronouns and their role in this work. So I'll popcorn to Zainab because I see you next on my screen.
Thank you, Jenna. Hello, everyone. My name is Zainab, and I am the research assistant for the RWJF project. I'm really happy to be here today. And then I'll popcorn it to Annie.
Hi, everyone. My name is Annie. I use she, her pronouns. I'm one of the co-project managers on this project and a second-year master's public health student at the University of Minnesota. And I'll popcorn that to Emma.
Hi everyone, my name is Emma and I am also a second-year Master's of Public Health student at the University of Minnesota, as well as the other co-project manager on this project. And I will popcorn to Megan.
Yeah, hi everybody. My name is Megan. I use she, her pronouns, and I'm the Youth Health and Housing Lab Program Manager. Jan, do we want to have youth introduce themselves now too?
Yes, please. They're part of our team. So please hop over to whoever
Okay.
Whoever youth wants to go.
Sounds good. Janae, you're first up on my list, so you want to introduce yourself?
Hello, I'm Janae Peterson. My pronouns are she, her. I'm with the YAB and I'm a co-presenter today. Nice to be here.
Janae, do you want to
Emmett?
define YAB for this group?
Sure. So the YAB is the Youth Action Board. We work with a lot of different organizations within Hennepin County, and our goal is to end homelessness within Hennepin County. Work with organizations to make more youth-centered spaces and to uplift youth voice, and honestly, not just youth voice, but also youth autonomy, and youth consent. So great to be here. Thank you for listening. Is Emmett available? Popcorn to Emmett?
Yes. Good morning, good afternoon, depending where you're at. I am Emmett Dysart, and I'm a former YAB member as well as a policy fellow over at Youth Prize. And I'll pass it to Lenary. You're available.
I'm sorry, I totally missed it. I'm so sorry.
No worries. We were just doing intros.
Hi, this is Lenary, she, her, fellow member from Youth Prize. I'll pass it to Janae.
I already went Lenary. Maybe pass it to Saint.
Hi everyone, I'm Saint, she, her pronouns, former Youth Action Board member. Really excited to be here today, and I can pass it to Lo.
And Lo, I think in the beginning you were not in a place where you could be on verbal audio. So do you want us to introduce you? Or do you want to introduce yourself in the chat? Or if not, I'll share it with the group. Oh, I saw them from before. You probably can't see that. I'm Lo, and I'm a youth advocate at Youth Prize, is what I see in there. Cool. Did we get everybody on our team? I think so. All right, and I just want to highlight here that youth are actually, in this project, it is a youth participatory action research project. I'll define that a little bit more as we move. But when I think about the youth who are on this call, they've also been not only drivers and participants in the research, they are actually like co-researchers with us. So within that framework, youth are experts, and they're not only in their lived experiences, but in this work, and have really driven this work forward. The folks on this call have been intimately involved from start to finish. So like literally from the beginning of the project as we were planning it to the analysis to this implementation where we're at now in dissemination. So thank you all for being here. You're a part of this team. Okay. So for background, 4.2 million youth experience homelessness annually in the United States. That can look a lot of different ways. And for this reason, youth are often undercounted when we think about youth experiencing homelessness. So not only is it what you might traditionally imagine, as you might see in the background of this picture, people sleeping on the street or staying in shelter, couch surfing, being thrown out, running away, also are common experiences among young people experiencing homelessness. And though many people picture kind of the picture in the background I showed you, youth come from a wide variety of diverse backgrounds. They have a range of experiences. And honestly, they look like every other young person between the age of 11 and 26 you might imagine. It is not possible to tell by looking at somebody whether or not they're experiencing homelessness. And this particular group represents a remarkably diverse and resilient population in the face of tremendous adversity and oppression at the hands of systems. Also, by way of background, when we think about youth homelessness and the drivers of youth homelessness, there are a lot of structural forces at play. Right at the top here in the middle, you can see systemic racism and oppression and systems involvement, both of which are direct drivers into youth homelessness. Specifically, justice system involvement and foster system involvement are there's a strong intersection between foster and justice system involvement and housing involvement and homelessness. And I bring this up because homelessness has been criminalized. Historically, and many of the elements of homelessness have been elements required to survive during experiences of homelessness have been criminalized. And as a result, there is a high intersection between that. Likewise, those systems directly often exit directly into homelessness as well. I also want to point out domestic violence and abuse and a lack of affirmation of identities, which is one of the reasons why LGBTQ+ youth are disproportionately represented among youth experiencing homelessness. And I want to point out that, again, the systems and structural oppression have led to limited educational employment opportunities, low wages, rising costs of living, and intergenerational poverty. And then finally, as we all know, especially in light of recent global crises and immigration, there is a large influx of young people experiencing homelessness as a result of youth who are on the move or in transit as a result of local and global crises. Key frameworks for the project we're about to present come from what's called the 9 evidence-based guiding principles of youth work. This was actually developed in our community with input from youth and from community partners and from multi-sector partners, and it's used nationally now. Some of these principles include being strengths-based and trauma-informed and anti-oppressive, and youth-centered, community-engaged, and harm reduction. These are key frameworks as we thought about planning this project and in every step of the way in terms of data collection, implementation, and dissemination. And this is one of the reasons why youth are directly involved in every bit of the work we do. Finally, I introduced a term called youth participatory action research. So I wanted to pause here and kind of think about this for a moment. Again, this is a framework or a way of doing research where youth are directly active as co-collaborators and co-researchers with us in the work that we're doing. So again, this is moving beyond youth being just recipients of research or participants in focus groups or interviews or surveys to a place where they are co-collaborators with us. And this youth participatory action research model is not only a framework or methodology, it's also part of an intervention whereby we're centering youth voice at the hands of or within systems from which they've been historically excluded, including the public health system, the healthcare system, and the social services systems that we work to bring together in systems for action. So I'm making kind of a big deal about this YPAR framework because it is a shift from a traditional research model, and that it's instrumental to our methodology and also is part of the intervention of multi-sector work that centers youth voice and those with lived experiences. I'll share a little bit about our project now at this point, and then we'll hear from youth a little bit about what it was like to be a part of this project and about their perspectives. Our project started with identifying community needs and priorities. This began with a needs assessment and with systems mapping as well. And we mapped out kind of where the gaps were in our systems for addressing health and for improving health outcomes among youth. So this was kind of a multi-pronged process that began in our multi-sector team that already exists, which includes Minnesota Department of Health, Department of Human Services, 5 or 6 different youth serving agencies and youth experiencing homelessness, as well as our team from the University of Minnesota, came together to lead this needs assessment and identify some priorities. From there, we used consensus building processes with youth, community partners, and multi-sector partners who continued to meet throughout the project to build out an implementation plan. And that was an iterative process using focus groups and again, our multi-sector consortium and centering youth voice throughout all of it. We then implemented the plan with youth and community partners. These included several different interventions that we'll talk through in detail today. We then evaluated those programs and implemented and evaluated those programs and then tried to improve them in real time based on input from youth and from youth serving agency staff who were recipients of the program. And then finally, and this is where we're at right now, and actually this ResProg is a part of that, we are disseminating and translating this work and we're thinking about how to scale it up. So as you can see in every part of this process, we've engaged youth and community and have kind of used an iterative process to improve the strategies and the interventions as we went. And each of the interventions was driven directly by youth and community partners along the way. So I'm going to pause here for youth input as well. We have an initial prompt for youth here. What does it look like from your perspective for youth and others with lived experiences to meaningfully engage in research, and why is that important? So I'll pause here and ask youth to speak on this if you're willing to, or drop thoughts in the chat too.
I could speak on this.
Thanks, Emmett.
Yeah, no worries. So just from my perspective, why it's important for youth and others with lived experience to engage in research is it's creating a narrative. A lot of times our narrative, when I say our, I'm talking about youth who have experienced homelessness, is shaped for us. And so when we're able to be a part of that molding process, it not only gives us a voice, but it uplifts the truth. Because there's a lot of things that don't get reported. And in these kinds of conversations for the people that are making decisions for us, policymakers or directors of system services. Like they don't they come in with good intentions, but they don't really have like the full details on how um, people like ourselves are experiencing life. So being able to like craft our own narrative is one really important reason I think answers that question. Others?
Thank you, Emmett.
I can answer that.
Oh,
So the initial question of what does it wait, I can't hear you guys. Okay, there we go. I had to press a button. But the initial question of what does it look like from my perspective, honestly, I think with youth and housing lab, I think you guys really executed it well. There's been spaces I've been in where they want youth present but don't want to actually hear youth voices. And even if they do want to hear voices, youth voices is still very minimal. Um, I feel like you guys have really boosted our voices and also given us a huge part in mapping out everything, which is huge and should be a part of every interaction that we have with people that claim to want to boost youth voices. Um, it's obviously really important because, like Emmett was saying, you can't have discussions about us, for us, without us present in these spaces, without us being able to at least agree with the decisions being made and saying like, yep, I think this would be helpful for us. And so, yeah, I think it's been executed pretty well with the way things have been done.
Thank you, Saint. Janae, I think you had something to share too.
oh yeah, I clashed with Saint. Sorry about that. I just feel like when it comes to youth collaboration, it would make sense to ask youth what they need, what they want. Not only that, but like what their experience is. When you go to the doctor, they ask you, what is your injury? You're in a crisis, you have needs. I feel like the same basic needs should also be given to youth, especially in a shelter setting. And I also feel like when it comes to collaboration in itself, collaboration is not just like giving a survey to a youth and having like very specified questions. It's like giving youth the freedom to voice, their opinion and voice their needs and voice their wants. So I feel like that's also another thing. Thank you for listening.
Thank you, Janae. And then I want to share a couple things that are in the chat because I think the chat may go directly to panelists instead of the full group. So I will share here. Lo said, I believe it's important to use your voice in these meetings because a lot of the time your wants will go unsatisfied because nobody ever spoke up, or a lot of things will go unnoticed when it's a priority to make sure youth has a safe space within us. Then Ebbett said we shouldn't be tokenized any longer. Yes, so it is moving beyond tokenization and surveys and participants to actually having youth be active, engaged members of the team along the way and creating the space for them to do so. Okay, so we're going to move on now to, from this process, kind of where we landed in terms of systems alignment strategies, since this is a development grant where we're developing these strategies alongside young people. So there were four main kind of areas of focus or strategies that emerged. And I'll start with the purple one here, which is Youth Health Connect. The purple one is Youth Health Connect, which is a digital community health resource map. We'll actually show you some screenshots from this, but this is a map that came directly from Youth Ideas that allows them to map out their local health resources. And this can be utilized by young people who are experiencing homelessness, and it can be utilized by case managers or staff at housing agencies to help, or by healthcare providers to help youth connect with healthcare or public health services that they need. And they can filter by type of service and also by elements of youth friendliness. So more to come on that. Youth also asked that every youth serving agency staff with which they interface and healthcare professional receive trainings on mental health and on health literacy and supporting youth in navigating health systems. So we'll talk a little bit about that today and those findings. They asked for improved and expanded site-based health services for youth experiencing homelessness, and we've moved forward on that as well. And then finally, expanding mental health supports for young people on site at shelters. And that included environmental and structural supports to improve mental health and trauma-informed care. And then it also included like shelter-linked mental health services. And we'll talk a little bit about that too. And then finally, all of that needed to occur in the context of an more equitable data ecosystem. And for that, we move forward with co-creating a plan with youth and community partners to improve the current data ecosystems, which are quite siloed and fragmented. So we'll share a little bit about that plan too. So now we'll go kind of strategy by strategy and talk a little bit about what we learned and what we heard. So we'll start with trainings, and I think Zainab is going to lead a little bit and share a little bit more about what trainings for youth serving agency staff look like.
All right. Hi, everyone. So yeah, I'm going to be talking about one of our alignment strategies, which was staff trainings. And this was something, as Jana emphasized, really came up by youth, and they really drove the whole process of creating these training slides and also to present these trainings to youth serving agency staff. So it was really incredible to see them work throughout the process. So the goal of our trainings was to train and provide resources to youth serving agency staff and case managers to support youth in navigating health systems and improving mental health. So we had two different trainings, which were mental health and health literacy trainings. The mental health trainings really focused on what trauma-informed care was. It was to really allow the youth to share and also for us to train staff on how to best support youth mental health by providing trauma-informed care and support that creates a therapeutic, supportive, affirming, and safe space for youth with diverse backgrounds and identities. And then the health literacy trainings addressed the challenges that youth experiencing homelessness faced in navigating the healthcare systems and increasing their awareness and connections with local healthcare and public health resources. So the number of trainings that we did so far is 6, and then the participants that we had is 160. And obviously we hope to grow these numbers as we continue with this project. So for our mental health trainings, we had 3 different sessions attended by Bryn Mawr, which is the Minneapolis Schools, 180 Degrees, which is a shelter-based organization, and then also just the overall big group of Minnesota-based shelter healthcare staff. And then we were able to, after the trainings were executed, we were able to do evaluation. So sending out a feedback survey on what the staff learned before and after. So I want you all to focus on the navy blue. Yep, thank you, Jana. So we have from before, people not really feeling confident in applying a trauma-informed approach in their work. And then after, you see that big leap in that navy blue section. So this is what our goal is. We want people to be able to feel like they learned from these trainings. And the one thing that we really appreciated was youth having a strong perspective in these trainings and obviously showing what they went through and uplifting their voices and having the courage to stand beside us in front of large groups especially. And then, yeah, the second question is, I can identify several strategies to support youth health literacy. Oh, that's for the health literacy trainings. Okay, so for our health literacy trainings, they were attended by Reproductive Health Action Group, again, 180 Degrees, and then that big, large group of Minnesota-based shelter healthcare staff. And then again, just looking at the evaluation aspect, really focusing on the navy blue, you see these 2 questions that we had, which showed statistical evidence that was significant. So we have, I feel confident helping youth navigate the healthcare system. Again, we see that leap is what we want to see. And then I can identify several strategies to support youth health literacy. Again, looking at that big leap, which is something that we really are hoping to gain from all the trainings that we do. And again, our large goal is to spread these trainings throughout Hennepin County and beyond. And then I want to pose this question for the youth because, again, there were a huge important aspect of creating these trainings. So literally from creating the slides, editing the slides to presenting these slides. And I want to hear the youth's perspective on what was it like participating in the trainings and what do you think were the most important take-home points from the trainings? Again, if you're willing to share, that'll be great. And then if you want to say anything in the chat, that'll be also great.
I'll go first.
Thanks.
I can just share the one that I wrote yesterday for yeah. So I wrote, I've had a great and insightful time participating and sharing out the trainings. I felt like I was a part of something bigger than myself and helped shape the way people view youth experiencing homelessness and trauma. From my perspective, lived experience engagement is everything that's needed in the work, and there cannot be decisions made for people with lived experience without them present. I hope that in the future we can get some more of these trainings going so teachers and staff know how to better handle situations with youth actively in survival mode. I think environmental supports will positively affect youth and shelters and their mental health because there's obviously care and planning that goes into getting materials they need. There's also the fact that there's a clear safety net when there are resources available for youth when they're going through crises and the knowledge that they don't have to go through it alone. I'm very grateful to have the experience and opportunity to work with Youth Health and Housing Lab on this and hope it continues to progress throughout the years. So that's what I wrote. But on top of that, I just would like to say I'm very grateful to have felt heard and seen in all of this because we were very connected with the work. There was constant like actual back and forth communication. And it just felt like I said, I was a part of something bigger than myself. And I really do hope that these trainings can continue and progress as time goes on and that more people can be informed about all of these things. So thank you.
Thank you, Saint. That was really amazing to hear. And then Laneri in the chat said, my biggest takeaway was the website built for the young youth to have access to resources. Yeah, so Annie's going to be expanding on the website more. And I wanted to point out that that website includes mental health resources as well. So that was a big thing that we also highlighted in the trainings. Thank you, Laneri.
Any other youth perspective? I didn't mean to cut that short. If not, I will move on to, oh, Janae, yes.
It was amazing working with you guys. It was amazing. I absolutely enjoyed every single moment of it. I enjoyed feeling heard. I enjoyed having my experiences be something that isn't stigmatized, something that I didn't get, the pity face for. It was something that they analyzed. They're like, oh my gosh, obviously, they cared, but they actually used our experiences to create a website, to create data, to actually help youth. Like, it is amazing to see from step one of us just talking about the idea or maybe even just the intent of doing something that is big, because this is big. And I am grateful as well. I am very, very grateful, and thank you. And also, I'm really grateful to the wonderful people that I worked with and the wonderful people that I, some of them I still work with. So, yeah. I'm really grateful. Thank you.
Thank you, Janae. It was wonderful working with you. And then I'll read some points in the chat as well. For Emmett, he said, being able to be exposed to other youth's perspectives broadened my understanding of others' experiences. This is truly so important because people need more perspective. Yes, thank you, Emmett. And then Lo said, I liked working with you guys. I appreciated how you guys still worked with us and kept contact unlike the other organizations.
Okay, I think we're going to move on to talking about the second one, which is actually the one that Laneri was mentioning too, around Youth Health Connect. So I think Annie will take on this piece if you're in a place to do so.
Yeah, absolutely. So excited to talk a little bit about Youth Health Connect. This was the digital health resource map that will show some screenshots and we'll include a QR code in the later on slides. But the idea for this really started out in focus groups and interviews with both youth and youth serving agency staff. And we heard that it would be really cool to have some sort of website or capability to look on a map and see where you can actually access healthcare by type of healthcare and by some other filters. So this is a visual that we kind of created after hearing all of these ideas. We just wanted a way to represent all these cool ideas we were hearing, and we took it back to a youth advisory board meeting where a lot of the youth leaders on this call were present. And those Post-it notes around the outside of the graphic were actually more ideas that we heard when we took back this original idea of the website to youth. And we heard some ideas such as a section on the website about Know Your Rights info section on healthcare rights. We heard ideas about making the website printable and adding more filters than what we had for patient population. And we were able to really implement those before we even started totally working on the website, which was really cool. And then if we move to the next slide, the next step was really working on collecting all of these resources And so we worked with a really cool youth advisor whose name is Lee, and they were awesome. And they put together this giant spreadsheet of all the different points of care around Hennepin and Ramsey County, and some points of care in rural Minnesota as well. And they were looking on websites, they were calling folks, they were trying to figure out what types of healthcare were provided at each of these clinics. And then we began the actual website build out and disseminating that website and getting more feedback from youth. So if we move to the next slide, this is a little bit of what the website looks like. We have this home about section. We have this map, which you can see kind of underneath that over top graphic. Then we have a My Healthcare Rights section, and that QR code will link to the website. But the next big step was getting the website in the hands of youth and actually having them test it out and see where we could further improve and add on to the website. So we had 6 youth, most of which who are on this call, test out the website for about 4 hours and just try out all the filters and give us even more suggestions on how we can improve the website moving forward. So some ideas you can see in this graphic that they gave us for this next round of feedback was making sure that the website itself is able to be translated and viewed in other languages when you're looking at it, expanding the geography. So we're actively trying to collect more information about clinics outside just the Twin Cities area, including a Braille filter to understand what points of care have Braille signage and materials available in clinic, understanding what points of care would have food available both inside and near the location. And then since we do have a lot of written text and images on the website, we wanted to really make sure that it was written in a way that was youth friendly and that the images were actually representative of youth themselves. So we heard a lot of suggestions on tweaking that. So we're in the process of making those changes. But if we move to the next slide, most important to hear from the youth leaders on this call who are actually piloting the website. Curious to hear if y'all have any thoughts about what do you think of Youth Health Connect and what do you think the impact will be on youth you know, and just what the experience working on this website has been. So I'll open the floor.
I will speak on it.
Thanks, Janae.
I really, really liked Youth Health Connect. I think one of my favorite attributes about the website is when you actually click onto a place on the map, it will show you not only different, like how many different locations are near you on the map, it will also show you a link to the website, a link to the phone number. It makes it really, really easy to not only like see the place, but also get in contact with the place, which a lot of resources that I found don't have updated phone numbers. They don't have updated locations. So I thought that was really nice. I also looked on Google Maps for a lot of these places to make sure that the information was updated, and it was. I thought that was really wonderful. On top of it, there's a lot of different subcategories for youth to choose from. I personally will use the website. I was all giddy and excited about it. But there's a lot of subcategories. So if youth who are LGBTQ, like myself, are looking for LGBTQ friendly places or places that are already knowledgeable in healthcare rights like that, I could click that. I could click a box. And then my search preferences would like pop up with LGBTQ clinics, whatever I'm searching for. I really like that. I also really liked how it had also like different forms of like not free healthcare, but like it had like Planned Parenthood on there, and like other forms of healthcare that like don't immediately need insurance, because I think that's a really big thing. Not all youth like have insurance when they're in a crisis. So I really, really loved the website. It was super, super easy to navigate. It had clear cut instructions. They're very straight to the point. Honestly, I think most people, including people with disabilities, could use it. So I really, really love the website. So I think that it's great.
Thanks for sharing, Janae. And Emmett just wrote in the chat, I think the website is so cool in the sense of navigation of resources. I truly wish it was available years ago. The fact that it's here now makes me optimistic for others. This needs to be available for all major metropolitans across the globe. It's crucial we continue expanding this resource. Cannot agree more. I think that's one of our next steps items that we will be touching on at the end of the presentation for sure.
And then Janae added, I know, God, I wish I could like the comments preach. So I think that speaks to that. Okay. We're going to move on next to mental health supports, and we'll continue this conversation in question and answers too. And I think Zainab will probably lead this mental health support section. Yes.
Yeah,
No,
I can
yeah.
lead this section.
Okay. Or is it Emma? Sorry, did I get it wrong? I can never remember who.
I'm fine with either.
Who was going to do it?
Doesn't matter. I can do it.
Emma, go for it. You created these slides. Go for it.
But yeah, so for the mental health supports, we heard from youth and youth serving agency staff as well as our cross-sector team that in addition to having on-site therapy and those types of services available for youth, it was also really important to have like physical environmental health supports. And so we worked with youth to co-generate a list of what these mental health supports could be. And then we have begun piloting this by purchasing these supports for 6 total youth serving agencies, 4 in an urban environment and 2 in a rural environment. Can you go on to the next slide, Jonah? So some examples of these supports that agencies had the options to pick between included pronoun pins, fidgets, art that was kind of supportive and created a more safe space, binders to have accessible for youth, books, especially more inclusive books, including religious texts that were more inclusive of LGBTQ plus youth, as well as other books in that kind of category, as well as just kind of art supplies to have youth have access to those sorts of like art therapy and something to do in their free time that isn't necessarily talk therapy, but still contribute to their overall mental health. And like I had stated, we are doing current pilot testing with 6 youth serving agencies, and we are completing interviews with youth serving agency staff to understand how supports are being utilized and their impact and what that really looks like in their specific agency. And we are also in the process of getting youth-focused feedback on the feasibility, acceptability, and potential benefits of these interventions, as well as getting feedback from youth on if these are things that would currently or would have benefited their own experiences in these youth serving agencies, and what other supports they think would be helpful if we were to continue to provide these things to youth serving agencies. And so now I will pass it to youth to answer this question of how do you think these environmental supports will influence mental health for youth who interact with them in shelters or youth serving agencies. And I will open the floor to youth.
Do any of the youth have anything they want to share about these environmental health supports, the binders, the having pronoun pins, texts, things like that?
I am widely in support of all of those things, especially the pronoun pins and just the binders and literally everything. I'm heavily in support. When it comes to mental health needs, they're just as important as physical needs. And when it comes to having your identity, you as a person being accepted, I feel like that is a basic need. And doing small things, because those are small things, like that for youth to feel like not only that they can claim their identity, but that others around them they're in a safe enough space that they also accept their identity. And I think that is a really beautiful thing. Not only is it a beautiful thing, it's a right that every youth should have. So I am very much in support.
Thank you. And I see Emmett wrote in the chat, provide optimism. These provide optimism and hope, and they give ideas for future success. Thank you. All right. We'll move on now to site-based healthcare. This was an exciting part of this project, and I think it's just the beginning of something larger. So essentially, there were three kind of big picture things. The first thing we did when we heard from youth loud and clear that they wanted the healthcare organizations that they were working with out in shelter, meaning that they're people who were providing healthcare in shelter, when we heard that they wanted that care to be better, the first thing we did was actually bring together for the first time all of the folks who were doing shelter-based or site-based healthcare for youth experiencing homelessness. And this may seem odd, but we had actually never, I'm one of those folks. I'm a medical director at a local youth shelter. That's actually where I am physically right now. And this was actually something that had never been done before. So thinking about multi-sector work, these are folks who are doing healthcare on site in shelters and agencies, and they had never really met each other. And one of the first things we did at the first meetings were actually come together with youth at that meeting as well and think about, like, what are the challenges we collectively face in providing this healthcare and how can we do it better together? So we had 3 consortium meetings. I'm calling them consortium, meaning a consortium of the healthcare providers that were there, that began and really worked through some of these challenges related to quality, related to barriers to care, and related to the kinds of care we want to be providing consistently and transparently across every single youth serving agency across the state. So that was really exciting in that this consortium formed, which itself is kind of a systems strategy. And that group will be now meeting quarterly, ongoing, to continue this work together. From that work, there was a conversation around bringing together shelter-linked mental health, which was another request that many of the youth had said early on, is that they wanted mental health care providers, both traditional and non-traditional, available to them when they were in shelter or in housing program. So in the light blue here, you can see shelter-linked mental health. We did that in a few different ways. We brought together all of the shelter-linked mental health providers that had recently been funded through a large program at the level of the state. We brought them together with the Department of Human Services to, again, think together about what challenges they were facing. From those 2 conversations with the group focused on shelter-linked mental health and shelter-linked healthcare, one big theme that emerged was that the medical legal climate was really unclear, and that each shelter or each agency was actually treating youth differently and understanding the law differently as it pertained to youth rights and access to healthcare. And youth, we had heard from them, as you saw on the Youth Health Connect website, that they really wanted to know their own healthcare rights so that they could autonomously navigate the healthcare system and also advocate for themselves when someone said, oh, you don't actually have a right to this care, when in fact they do. And the reason why this is important is that in the state of Minnesota, youth who are living apart and managing their own finances have a legal right to access all of their own healthcare. But yet many youth who are experiencing homelessness who would have met those criteria were being turned away from healthcare. And then even within shelter, each shelter and each agency was handling this a little bit differently with what youth could and could not consent to receiving. Even things as simple as receiving Tylenol or ibuprofen when someone was having a headache or period cramps, the shelter-based healthcare folks were saying each agency had a different rule about whether or not youth could get this, even though any of the youth could have easily walked into any Walgreens and purchased these things independently. So what we did from there is we moved to create a medical legal partnership or a healthcare legal partnership with the Youth Law Project. And the Youth Law Project is a local youth serving agency or organization that actually brings together lawyers to provide free legal counsel for youth experiencing homelessness and for young people under the age of 18. And in partnership with a lawyer from the Youth Law Project, which is a part of Minnesota Legal Aid, we developed 2 legal briefs that we've actually shared now with youth serving agency executive leadership and with the Department of Human Services and with the Minnesota Department of Health. And we are moving towards unifying policies to actually allow youth to access the healthcare that they need. And this may seem like a simple thing, but we've heard from our youth serving agency partners, from youth we work with, and from the healthcare providers and mental health care providers on site, that this means that this has made a major difference, or this could make a major difference in terms of youth navigating youth barriers to care. So I'm really excited about that piece, that I've heard a lot of enthusiasm from our community partners there. And those briefs are now published and are also available on our Youth Health Connect website for Minnesota. So I'm going to pause here for the youth perspective on this and ask, why are shelter-based healthcare and health services really important? And how do you think healthcare professionals working at youth serving agencies could do better to better collaborate together to improve the care that they provide? And you feel free to add your ideas on this in the chat. Or just speak up. So you call. Why are shelter-based health services, I was asked to repeat, why are shelter-based health services important, and how do you think healthcare professionals working with youth in shelters could continue to collaborate to improve the care they provide?
I would say using the knowledge that you get and the knowledge that you learn, holding other staff accountable, holding other youth accountable to make it a safe space for the youth. I would say using trauma-informed approaches that we've talked about. Collaborating with youth in itself is a trauma-informed approach. You are asking someone on an equal level, what do you need? How can we provide it? What are your experiences? And I think that, how do you say it? Like, I think that when it comes to shelters, especially, it's one of the most unsafe places to a youth. Not that shelters in itself is unsafe, but like the situation that you need to be to get in a place like that is unsafe. So just understanding, commitment, being being open.
Thank you, Janae. All right, I'm going to move on for the sake of time. I appreciate everybody's input. We'll wrap up by talking a little bit about the data systems alignment work that we've kind of done. The goal of this project was to generate a data systems alignment plan centering youth voice and community partnership. And so Annie will share a little bit about what we heard from youth in this process.
Yeah, absolutely. So to start out with, all of these ideas, it was a really iterative process. They came from focus groups and interviews with both youth and data systems experts. And from those initial ideas and those initial meetings, we kind of took what we heard and made kind of this draft of a plan, and we brought it back a couple different times, I think at 3 different meetings with our cross-sector consortium, community partners, and youth. And through that process, we really looked through each item and made inclusions and edits and added in what people really wanted to see. So to really briefly, for the sake of time, talk through what these ideas that are outlined in this report talk through. The first idea was to foster a Ramsey and Hennepin County partnership. For those unfamiliar with the Twin Cities area, Minneapolis and St. Paul are actually in different counties. This can make it really hard to collaborate on benefits such as SNAP, so that there can be worries about losing those benefits if you move literally one city over from Minneapolis to St. Paul. So one of our goals is to kind of identify goals for Ramsey and Hennepin County to continue to partner on. The next was to clarify minor consent law and privacy rights of youth. Jana talked a little bit about this. This has been a lot of our work collaborating with the Youth Law Project on clarifying both healthcare rights and youth rights to shelter through these briefs that we collaborated with them on, and disseminating that to appropriate audiences and making sure that there's plain language interpretations of all of those statutes, which can be really confusing for anyone to read. And then the next idea was to leverage existing data sets. And what this looks like is taking these really giant sources of data. For example, there's something called the Minnesota Student Survey, which asks every student in public school in Minnesota to answer some questions related to demographic ideas and other ideas, and really looking at those data sets and identifying questions that youth want to see from them, as well as community partners. And then the next was centering youth voice in data systems. This could look like engaging youth in modifying data systems meant to serve them, such as HMIS and youth serving agency-specific data systems. These can be pretty siloed, and as a result, often don't center the people that are actually mentioned within the data system. So really taking a look at those and making changes where needed. And then transparent trauma-informed health intake and healthcare processes. This gets back to our idea of the mental health and health literacy training, really working to expand that and tailor that to make sure that the transparent trauma-informed health intake and healthcare processes are happening across the Twin Cities, especially. And then this last point, ensuring clear information sharing limits. So ensuring both youth and staff understand what data may be requested and what data might be shared between organizations and with parents and youth, and really creating kind of these plain language guides for folks to really understand what can be shared and what cannot be shared. So that's a really broad overview for the sake of time, just so we can move to next steps in Q&A.
Yeah, so we'll wrap up together here with next steps. From a big picture perspective, we want to scale up all of the things that we have talked about and shared today and continue to grow them and evaluate them. But I want to set our youth voice here, and I saw Saint's hand up with where you hope to see we go with this, and how youth and those with lived experiences can be involved. Saint, I saw a hand up, maybe.
It was an accident. I was trying to clap for Annie, but they don't have the emoji things on here. So yeah, I'm gonna pass. I'm sorry.
No, you're good. Where do you hope to see all of this work you've worked and partnered on in the last year? Where do you hope to see it go? And I'll throw this out to all of them. Sorry, Zay, I didn't mean to call you out. I also am clapping for Annie.
I guess I'll pop in. Hi, I'm Jerome. I was having tech issues, but I'm happy to maybe just share before the conclusion of today's conversation. My experiences was nothing limited, and was fully immersive and very beneficial, particularly in this idea of like learning and growing. I hope to see um, this opportunity presented to much more than a small cohort that was given the opportunity in Minneapolis to share their lived experiences, share our lived experiences. And I think there's a lot of opportunity for liberation and resilience, while like actually being a part of the solution that you are like being affected by. Like imagine like having these traumatizing experiences, but also simultaneously being empowered within that, and kind of changing the status quo and the foreseeable future for yourself and others. I think there's nothing better than working through and problem solving the actual problems that are existing in current moment, like the real-time experiences you have, opposed to, you know, receiving some sort of aid or financial assistance, or this like miraculous opportunity where you then are no longer in the situation and kind of may not have the same perspectives and or like real time like opportunity of growth, like actually doing that while you're living those experiences and also being empowered by other people, so that you're not feeling alone while working through those problems is very rewarding. I think like for me, like some experiences I've had is like as a college student, it's been hard to like navigate and like make money and all these sorts of things to sustain as like a young adult. But I think like what I'm most attracted to is like the process, and what I know I'll I'll have the best outcome is from the process, not from like after I graduate and get this degree and then go back and try to do research and try to create all these world problems and solutions. I'm actually doing that like while I'm impacted, while I'm being affected. And I think there's a uniqueness of that, because you're able to be more sensitive to like what's happening in real time. And yeah, I hope I'm not rambling, but it's like just the actualization of it. It's so real. Like it's not something that like used to be, or it's not something that, while there's like great triumph and champion and becoming more successful than what you were or having more resources than what you had. But there's even more triumph in problem solving and creating solutions in that current moment and while you're in your current situation. And it can't be done without the support of other people like Jana and these folks who have put systems in place. I would actually say tore down systems and rebuilt systems to then put those in place so that we can have that learn and grow opportunity that feels good. You know, it's like hope um, and not like, you know, the sense of like, and even like there's this thing of like imposter syndrome. Like, I don't like, am I really deserving of this? Like, and you get that imposter syndrome a lot of times, like, you know, after the fact, or like, I think while being in that situation, like you don't, a lot of times you don't get the imposter syndrome because like you're living it every day. So it's not a feeling of like, am I good enough? I'm constantly told I'm not good enough. I'm constantly living experiences that prove that I may not be perceived as good enough to be successful, but actually problem solving in that moment uh can really change like your whole perspective, you know. So
Thanks, Jerome. I really appreciate you speaking up. I also want to uplift something that Emmett shared in the chat. He said, please continue, or said, continued research, exclamation point, more funding for projects like these with a heart and hands emoji that I'm trying to do. So I appreciate every youth on this call and all of your work in driving this movement forward. I agree. We are trying to, in some ways, restructure systems, in some way tear down systems, and in other ways, try and center youth voice in the systems that do exist and in the new systems that are being built. So you've been all, the youth on this call, the youth leaders here, Saint and Lo and Janae and Emmett and Jerome and Lenary, like have all been instrumental in this. And I'm eternally grateful. And I hope we get to work together more. And we will. All right, with that, I want to leave a few minutes. I know we went a little over, well, we haven't gone over time, but we wanted to leave some space for questions and reflection. And I see a couple questions in the chat that I can start answering while we move forward. Carrington, does that sound okay?
Yeah, I think that sounds great. And I just want to let everyone know that if you do have questions, and I know we only have 3 minutes left, you can still put them in. It's totally fine. I think it's important to hear the voices and hear about your research. So if there are questions that you still have, you can either email us at systemsforaction at cuanchutes.edu, which will be in the follow-up email that we send after today's session, or you can go ahead and put them in the Q&A and we'll have all of those questions after this session and we can get them to the research team so that they can address those. Okay, Jana, I'll let you address the questions that have come in.
So the first one was from anonymous attendee, number 1, and it says, what does health literacy look like in regards to youth? Are you able to provide examples? Absolutely. Sorry, new to housing. And the answer is, specifically, this refers to empowering youth and uplifting youth and building youth skills and being able to navigate across very overly complex healthcare systems. So some prime examples of this would be things like working with youth, and the youth on this call actually co-created the health literacy presentation with us, but working with case managers to teach them how to support youth in navigating systems, teach them how to log into MyChart, teach them how to access medical transportation so that they could get to and from their appointments. So the case managers then knew how to help youth navigate or get health insurance, and even things like encouraging and coaching youth to write questions down before appointments or to send MyChart messages in if they had questions, or to take pictures of their medications and their allergies so that they know what they are. So there's some prime examples of teaching youth how to navigate really overly complicated health systems that were not built with youth in mind, if that makes sense. The second question I see is, has anyone offered spiritual care, not religious care, while in shelter? The answer to my knowledge is, Carrington, would you like to answer? To my knowledge, within this project is no. We had some many non-traditional ways of approaching things, but we have not so far to date, and I am not aware of literature to date that has engaged a chaplain or a spiritual leader in shelter. I know in the shelters where I work, we support youth in connecting with spiritual elements that are important to them, but I haven't seen that yet, and it's a really cool idea. If anyone else wants to weigh in on that, maybe I'm not familiar with the literature too. And I see the third question was to repost the QR code. So I'm going to go back in time and pull up the QR code for Youth Health Connect, which I think is probably the QR code that people wanted. And you can also get to that from our lab. And then were there any providers that are pushing back in the beginning, or did any youth feel that it was hard to get through to any of the providers? I will say briefly that yes, there were shelters. There is always at every meeting, both youth serving agency leadership, DHS leadership, MDH leadership, and also healthcare professionals who were pushing back in different ways. And we manage that resistance by working through it and trying to uplift and center youth voice. If any youth want to speak to that point about places where we met resistance in the beginning or where you've met with resistance along the way in trying to overturn some of these systems or revise them, I'd love to hear your thoughts. You all spoke truth to power in a way that was much more powerful than I could have done. So I'd love to hear your thoughts. Did anyone perceive resistance from any of the systems that we were working with? And how did we handle that? I'm laughing because I know we did, so.
I could speak to it just quickly. There was resistance like within our own party, but conversation worked that out. I'll just leave it at that.
Yeah,
I would say too, like we also battled with like this idea of like tokenization and like being adamant to it that like our experiences and like my peers here who have like more latter experiences than some that I have, but we're like sharing like scenarios in which we all have felt tokenized and just understanding that it's so important to be genuine and give authentic opportunities that are actually transformative and not, tokenizing to best feel like inclusive and impactful, I guess.
Great. Thank you. I think in the sake of time, I'm going to go ahead and close us out for today's session, but I want to thank everyone for attending, and I want to thank the research team, especially for coming and presenting on this really important research. And it was great to hear all of these updates. And I know your team has been really busy with all of this, so we're excited to see what happens next. I think with that, we will say goodbye, but thank you again for attending, and we will follow up with an email with the recording and slides from today's session. Hope everyone has a great day.